I have had an irregular heartbeat for a long time, for quite a while. Because I was taking blood thinners, I experienced a stomach bleed. And I came to see Dr. Mustafa. Dr. Mustafa performed 2 heart operations on me. In one, he performed a filling procedure on the left valve of my heart. In the other, he performed a freezing procedure, and now I feel very comfortable. I am extremely grateful to my doctor.
Our patient, Ms. Ayşe, is 72 years old. She came with complaints of palpitations ongoing for a long time. We detected an arrhythmia in our patient. Diagnosis DIF. Atrial fibrillation is important for us in 2 ways, from 2 perspectives. One is that it causes complaints of palpitations. The other is the risk of a blood clot traveling to the brain. If the CHA2DS2-VASc score is high, if patient has other risk factors like high blood pressure, if risk like diabetes, age 2, then we need to prescribe a blood thinner. Medication was started for our patient, but afterwards she developed a stomach bleed due to the blood thinner, though administered low dose. And during this period, due to arrhythmia from atrial fibrillation, complaints of palpitations started to become frequent. Most of the time in these patients with arrhythmia, patients with rhythm disorders, a clot forms in that area and travels to the brain. We also, this region, we close off this area with a device and eliminate this risk. At the same time, the patient was having palpitations. To eliminate this palpitation, so performing an ablation procedure is suitable. For our patient, we decided on a procedure called cryoablation, ablation by freezing, and found this ablation procedure appropriate. In the same session for our patient, first we froze targeting atrial fibrillation, which is cryoablation for AF. After that, in the left atrium we call the appendix, which is the focus where the clot forms in that cavity, by using a device, thus reducing the risk of clot formation minimally. From this palpitation, our patient was saved, and also from the risk of a blood clot traveling to the brain. The procedure was very successful. Second day post-procedure, we have no complaints of palpitations at all. Atrial fibrillation has not recurred. There has also been no further bleeding incident. Monitoring our patient, our procedure was also completed successfully. In fact, atrial fibrillation ablation procedures have become common in most centers, but performing both procedures at the same time is not something done often. We decided that the freezing method was suitable for our patient. The left atrium was not dilated. There was only atrial fibrillation disease. We considered cryoablation for pulmonary vein isolation, PVI. The arrhythmia did not recur after the procedure, as I mentioned before. The other procedure was also difficult. In fact, performing both procedures may seem risky for patients, but having 2 separate procedures actually means undergoing anesthesia twice, which is riskier. That's why in a single session, under general anesthesia, and completes the process in a short time, in 1 session, we completed our procedure. Doing it this way is not a very common procedure. These are procedures performed rarely.
I want to thank Dr. Mustafa very, very much.
Thank you much, Aunt. I appreciate it.
Thank you. Lying down, I couldn't. Can't lie left side. I used to have a lot of palpitations, but now I feel really good. Because I trust my doctor very much, I am deeply thankful to him.